Hi, I'm Dr. Regina Joseph, Cosmetic Gynaecologist in HSR Layout, practicing at Splendore Aesthetic Clinic, Bangalore. Yes, the vagina does get stretched during the childbirth of the baby and also during the process of pregnancy. As there is a fetus growing inside the uterus of the woman, there will be a lot of hormonal changes. So there would be a lot of ligamental stretching and the pelvic muscles also getting stretched to accommodate the growing fetus. So hence a woman would definitely during the childbirth to allow the childbirth, so there would be lot of stretch in the vaginal wall. So this stretch maybe at the time of completion of the woman. What are the ideal candidates? If you ask me, a mother who has completed a family would definitely be an ideal candidate to go through the treatment in cosmetic gynecology, where we do vaginal rejuvenation using carbon dioxide laser, which is done on an OPD basis, and it's got no downtime and it is not a surgical procedure. It is given at interval of 4 weeks apart. 3 sessions are given, which causes vaginal restructuring and remodeling of the vagina through the carbon dioxide laser, which does restore the vagina back to a youth age. Thus, the childbirth and woman today, which is less spoken by the woman about the vaginal laxity, which can be corrected in cosmetic gynecology on an OPD basis. Thank you.